Good morning, everyone. Welcome to the Agency Technical Administrator meeting for March of 2023. I'm Mike Corcoran, the Director of Information Services with All Chicago. For this meeting, given the size and number of people participating, everyone is muted during the presentation. If you have any questions, please put them into the questions box in the GoToWebinar navigation there, and we'll get started. The agenda for today is up on the screen there. Got quite a full schedule, so I'll get right into it. The first item is an update from HUD regarding HMIS. Those of you who've been on the webinars before have seen this timeline. There hasn't been any major change to it. Right now, they are reviewing the requested or proposed data standards changes with HUD and federal partners. They're supposed to get that approved by the end of this month, and during next month release the standards to HMIS vendors, and then in May they'll release it to the general public, including us. The data standards for 2024 will be implemented and go live on October 1st of this year, along with SAGE and other things being updated to accept new versions of APRs, CAPRs, and the CE APR. So what we'll be doing between May and October as we review those and get a sandbox from our vendor and things like that is reviewing and figuring out what updates need to be made to assessments, to reporting, all sorts of other things like that. And we'll probably be conducting webinars during that period of time to review the changes and review what that means for everyone using the HMIS. These next few slides, including this one, are actually copied from the presentations that HUD does with HMIS leads. I'm going to go through these relatively quickly because they're still proposed and nothing's been finalized, but it's just giving everyone sort of a heads up on what changes are being proposed by HUD regarding the HMIS data standard. So the first category is project descriptor data elements. Again, note the first line there. Remember, these are draft changes and not yet approved. There's changes to emergency shelter tracking method, adding a rapid rehousing subtype to differentiate between rapid rehousing projects that provide services versus housing with or without services. And remove HMIS participation and create a new element to record whether they're participating in HMIS or not. Removing unused funding source responses, adjusting applicability of the bed and unit inventory to accommodate the new rapid rehousing subtype, and identify projects participating in coordinated entry, making and accepting referrals. And these slides will be posted as usual, and I can distribute them after the meeting. So there's no need to scribble things down or try to remember everything that's on here. We'll send copies of this around. The universal data elements. There's going to be data collection guidance for the legal name requirement. Changes to the Social Security number to collect only the last 4 digits. Combining race and ethnicity into a single element, and adding some response options to the gender categories. Regrouping and renumbering response options for destinations, and renaming the element and change data collection to be only at project start for the client location. This is something we ran into in the LSA in terms of having a correct client location for many of the clients. The project-specific data elements, changing labels for health insurance, doing updates for street outreach projects to the current living situation and date of engagement, and consolidating and updating CE assessment and CE event elements for coordinated entry. And then the federal partner specific data elements, retiring the well-being for the COC, adding sexual orientation to permanent supportive housing data collection requirements, HOPWA for W1 and services and W3 medical assistance, and RHY, service connections, project completion status, and counseling response label changes. So I'll pause there for a second. So I see Sarah's question about having to collect sexual orientation. Now, again, these are all proposed and draft changes. Nothing has been approved yet, so I don't have any detail on what this means practically until they all get approved. So I don't have a better answer for you yet in terms of what data will become required that isn't currently required or not. Any other questions on this section? Yes, Venetia will be sending the meeting slides after the meeting. The next topic is an update on the housing inventory count, the HIC. This year, the two surveys were consolidated into one, and we had about 80% participation during the 2 weeks the survey was open. We used that data to update the project inventories the week of March 6th in HMIS. You should have received a confirmation email with any changes that were made to your inventories. And there are business object utilization reports that show the unit and bed inventories for each project, so you can verify your inventory settings there. And we're currently working to review and update additional information gathered in that survey, project type, target population, and funding source. If you haven't received an update, you should have received an email for clarification or confirmation of what was submitted in the survey, and Alex will be following up with ATAs, those ATAs today. The inventory has been, we'll cover this a little bit later, the inventory has been an interesting item within the HMIS, and we're really focused on getting those inventories correct for a lot of different reasons. Again, we'll get into that a little bit more later. And the HUD submission date for the HIC is April 28th. So we're on track to complete that. So Venetia has a question: if we have projects within the agency that did not submit the HIC survey, can they still submit one? If not, what will happen to those projects that did not submit theirs? Alex, I'll defer to you on that, but I think we can still get the survey, or we can contact you specifically to go through your inventory settings and the other ones to update the data. Alex, did you have a different answer on that?
No, that's pretty accurate. Venetia, we can follow up this on any projects that didn't.
So for the point in time count update, there were 85 projects that participated. The number of projects that had to complete the tally and HMIS portion decreased from 25 down to 8. and the clients that were counted on the night of the count, it's about 2,600 in 2023. And that's based on the HMIS data only and not in comparison to what had been submitted through any specific specific tally. Alex Manisha says she couldn't hear you.
Yes.
Maybe I should mute while you talk.
Yeah, so for your question, what Mike said is completely correct. We can definitely get those surveys in. I will follow up with you after this call and we can identify what projects those are.
Thanks, Alex. And the HUD submission date for the point in time count is also April 28th, and we're on track to complete that. Any other questions on the HIC or the PIT? Data quality process is next. We're going to start the new data quality process on Monday, April 17th. The reporting period will be the calendar year 2022 from January to December. We'll hold a training webinar the week of April 10th. The timeliness report that gets generated by us will be emailed to ATAs. The revised data quality report is already available in Business Objects. Any of you who would like to validate the report, if you're interested in doing that with data prior to the actual commencement of the data quality process, please let us know. We'll be happy to go through that with you and make sure we build some confidence in that report. In previous years, there were multiple rounds of sending in preliminary results just to ease the burden on folks. We'll abbreviate that so that you only need to send in the final copies of the results by May 19th of 2023. And during the following week, we'll tabulate and post the results by the end of that next week. So that will be for 2022, and then the Q1 2023 data quality process will start in June and get into a cadence to do it every quarter following that. Any questions on that? Sarah, thanks for volunteering. And Dana, thank you as well. Sorry, I've got a screen issue here. Can everyone still see my screen? Okay, sorry about that. So the local valuation instrument is a local endeavor within the COC for certain funded projects to have various aspects of the HMIS usage evaluated. There's a separate team that does that. They're going to start their process for this year in April, and they'll be sending out the details on that. This is just a heads up for those projects that are involved in the LEI. That's commencing. They're going to hold some webinars, and we'll be distributing the initial set of reports and things like that at the beginning of April. So I don't want to steal their thunder or say anything else about it other than just a heads up for everyone that that's coming. So HMIS project inventories, I said I would come back to this during one of the prior slides. So for the prior topics, data quality, the LEI, and the housing inventory count, the project inventories in HMIS are critical to have accurate for that to work. So we've been working through part of last year, and also as a result of the pre-HIC surveys and things like that this year, to make sure that we have those inventories correct. So I wanted to spend just a little bit of time clarifying as much as possible, and we can, if there's confusion or further questions or things like that, we can schedule something with each of you and other folks in your agencies to go through and make sure that we have the inventories correct in the HMIS. So what I wanted to do is just do a quick overview. It may turn out to be not so quick if there's lots of questions, and we welcome those questions, about what's actually stored. Generally speaking, other than seeing things on reports, users don't have visibility to what the master data for your project looks like in the HMIS with the inventory data. Sarah, back on the LEI, sorry, I'll go back to your question. So for the LEI, will some of the data still be pulled from APRs? The answer is yes. Yeah, it has been conversations about how to account for clients who aren't due for annual assessments yet. Yes, we're having those conversations. I think last year, as we identified those folks, we sort of manually adjusted the numbers. But yes, several of the questions will still be pulled from APRs run on a calendar year basis. But again, there's a separate group running that. I don't want to be going into a lot of details on the LEI because that's in the data performance group within All Chicago. So back on inventory, so what it looks like in the HMIS is there are these things that are recorded for each project, and sometimes there are multiple records, and they have an example on the next slide. There are 3 possible household types: households without children, which are generally considered to be single adults; households with at least 1 adult and 1 child, which are family households; and households with only children, which most projects don't define inventory for. So you select the household type for each inventory entry that you do. So if you had some beds and units for single adults and some beds and units for families, there would be 2 inventory entries into the system for your project. If there were multiple bed types, so if you had household inventory for single adult, and some of it was facility based and some of it was voucher, you'd have 2 different entries just for the single adults because there were different bed types. And similarly, if you had single adult inventory and maybe it's facility based, but some of it was year round, some of it was seasonal, some of it was overflow, those would all be different entries into the system for those units. in most cases, and in the simplest case, there are at most 2 entries one for single adults, one for families. They're facility based and they are year round. And then since some of the stuff can be can change over time, there's a start and end date for the inventory. So you can have a different inventory in 2022 than you do in 2023, and we still have a record of what it was in 2022. And only those inventories, and when we do point in time counts, when we do utilization and things like that, we look for the inventory that was valid at that point in time based on the inventory start date and the end date. So for each one of those records, there's a total bed inventory, which is just the total beds, and then it can be broken down by dedicated beds to different populations. And again, in the simplest case, the total bed inventory is equal to the non-dedicated bed inventory, but there can be exceptions to that if there are specific populations that need to be served by the project. Whatever dedicated beds are specified, that total has to equal the total number of beds that's entered. And then the unit inventory is how many units, and the unit is defined as what households enroll in. And we talked about this a little bit before. I see a question from Bridget. Let me pause for a second here. So Bridget, I think maybe we should just set up a meeting to go through your inventory and make sure that we have an accurate representation of it. I'm not sure I can give a response in this format. But if you have some beds that are dedicated, if you have beds that can serve multiple purposes, we have to figure out a way to just have a static representation of that presents it in the way that it's most commonly utilized. But again, let's have an offline conversation about that to make sure we got the data entry correct on yours. Jennifer has a question of whether it only counts, does it depend on whether the household is moved in? It entirely counts on whether the household is moved in. If they haven't moved in, if they don't have a move-in date, then they're not counted. Those beds and units are not counted as being utilized. So a quick and simple example, let's say that there's a project that has 25 beds for single adults, 25 beds for families, and those family beds can accommodate up to 5 families at a time. So for the single adults, the household type would be households without children in the system. The bed type would probably be facility-based. The bed inventory is 25. For simplicity's sake, we listed all those beds as non-dedicated. And since single adults are checking in as a household, the unit inventory is equal to the bed inventory of 25. And we'll just put a start date as the beginning of the year for that. For the family inventory, the household type would be houses with at least 1 adult and 1 child. Again, facility-based. The bed inventory is 25. Again, for simplicity's sake, we set the non-dedicated bed inventory as 25. And the unit inventory would be 5, reflecting that 5 households are enrolling at a time, typically in this inventory. So that's a little context. Again, we're happy to have a conference with anyone who thinks their inventory is incorrect, but this is something we want to both get correct now and make sure is maintained correctly so that the data quality utilization reports, where the utilization reports coming out correctly, the housing inventory count is happening correctly, the LEI is happening correctly, all the stuff that depends on inventory and utilization of inventory. We want to make sure the inventory is represented correctly in the system. Other questions, and I can go back a slide if anybody would like. But this has been a focus for us over the past several months to get this correct, and we want to make sure that we've tied up any loose ends on it so that all the other reporting is correct. So there's a question, in a congregate setting with one large room accommodating 25 singles unit inventory would be 25, not one. That is correct. It's what the household is moving into. So if the 25 singles are each a household unto themselves, the unit is what the household enrolls in. And I know that can be confusing because from a physical standpoint, it's not unreasonable to look at that room as being the unit, but from an HMIS perspective, it's very different. The unit is what the household enrolls in. So if we set the unit equal to 1 and you had 25 households checking into it, your unit utilization would be 2,500%. Where what you really want to show is that it's 100% utilization from a unit perspective. Sandra has a question. There's an issue with our program reports, not picking up all the households' beds. Is this issue resolved now? I'm not sure which report or what exactly that issue was. If there's already a help desk ticket on there, please reference that, Sandra, or we can set up again a conference to go through what your issue is and make sure that that's been resolved. Yep, so if the HICS survey, if the data that was already in HMIS was different than what you updated in the HICS survey, those should all be updated now, and I'll again defer to Alex as to anything specific for Sandra's case.
Sandra, I would have to kind of review what our conversation was about the report. But like Mike said, if the inventory has changed, it has been updated. So hopefully it has been resolved, but I'll look back through to see where we left off with that conversation. I'll follow up.
Other questions? I'll just go back to this slide for a minute or two in case there are other questions about any of the specifics of what any of the data is regarding a project inventory. Okay, next topic is new user training. We made a couple of changes recently that, at least in some cases, is yielding some promising improvements in terms of the proctored sessions and things like that. One is that we're involving agency technical administrators more in the training and proctored sessions, and we've revised some of the proctored session content. So just wanted to say thank you to all of you who've been involved in that and having a partnership on onboarding new users. And if there's any feedback, suggestions, things like that, please please let me know how else we can making any improvements to how we onboard new users. Help desk tickets for data entry and correction. We continue to, in isolated cases, receive tickets requesting us to enter or correct client data in the HMIS. Sometimes it's associated with APRs. Sometimes it's just other reporting that's not coming out correctly, or people are seeing anomalous results. Let me stop there. Dana has a comment. Apologies if we didn't communicate sufficiently and effectively. So we'll resend those communications and make sure that we're making sure everybody's aware of any of the changes up front. So let me go back to that question since there seem to be some questions on it. And Rochelle, I think you're on the line in terms of whether ATAs can assist users with their proctors. Yep, so definitely ATAs are allowed to assist new users with their proctored sessions.
Hi, Venetia. So this is Rochelle. I just kind of wanted to talk about the new user training process right now. So the way that I've been completing proctors, I do include the ATAs or supervisors that at their agency as we go through each round of proctor correction. So if you're not being included in your users, please let me know because I do try to include you in all of my training correspondences with your new users.
Thanks, Rochelle. Other questions on training? So I believe we covered this information in a prior ATA meeting, but we will review the communication that we did and send everything else, send an update around to everyone to make sure that that we're all on the same page and you have all the information that you need. Other questions? Kayla, we can do that. We'll lay out the steps in the process and get that out to everyone. Sorry, I'm reading through the questions and comments here. So message received that in addition to updating the help desk articles, sending out notifications that those things have been updated and where to find them, duly noted. We'll do a better job of that going forward. Okay, so help desk tickets for data entry and correction. We're getting requests to go in and correct user entered data or add data that could be entered by users. And just a reminder that that data entry is the responsibility of the users and the agencies that have collected the data. It's not really appropriate for us as the HMIS lead to be entering or correcting data that can be corrected by the users. We're happy to consult on what the data should look like and things like that. So just a request to please make your users aware of this. And if there are exceptions, let's figure out what the escalation for that is and what that request process needs to look like. But I just want to make sure expectations are clear with the users in terms of when they identify data that's incorrect, what the proper steps are. Sarah, yes, we'll definitely turn that around. As we review the tickets, we're coming up with more internal procedures and things like that about how to deal with certain incidents like this. And so, yes, we'll definitely turn that back around to the ATA. Other questions, comments on this? Another topic is the email addresses used in HMIS user accounts. And we're finding that some users are using personal email accounts. In some cases, this is where the user is a contractor to the agency, or there's a relatively high turnover, or other things like that. The number of account, the way we can tell that for the most part is that the user accounts have email addresses with gmail.com, yahoo.com, Hotmail, things like that. The main use of this is for self-service password resets in the HMIS. So users with personal email addresses can renew their HMIS access indefinitely, even if they're no longer contracting with your agency or things like that. So it's a security and data privacy concern for us in administering the HMIS, and particularly user access to it. So we're going to start reviewing that. Sort of a heads up on this. We're going to start reviewing that, and where we find those, we like to have a conversation with each of the agencies where we're finding that, and figure out why and whether it's still appropriate for any personal emails addresses to be used, and either eliminate that or figure out a process where we can be notified when those users no longer need access to the HMIS, so we can disable their account rapidly. We just don't want people hanging around. In most cases, if somebody is part of an agency and they leave the agency, they no longer have access to their agency email and things like that. Whereas for contractors or other people using personal email addresses, they have permanent access to their personal email account, which means they can indefinitely renew their access into the HMIS, which is not appropriate. Kayla has a question: HMIS user account different from LMS? Yes, it is. Other questions? So Venetia has a question about whether ATAs have the ability to remove old users. We would actually like to be doing the administration on that, because there are other administrative things that you definitely don't have access to do that we want to make sure that we're performing as users are removed from the system. Yes, it would. Yes, thank you, Rochelle. Yes, it would help us a lot to get names of users no longer with the agency as part of your termination process, so we can remove them from the HMIS as well. Other questions? Comments? That's all the content that I had for this morning. So the slides, any other, before we, Sarah asked a question, in future AT meetings on a different platform where we come off mute and be on camera if we want. We can certainly look into that if everyone would like to have it be more of a communal meeting as opposed to a webinar. We can sort of look into that. I want to make sure that we can still have the same kinds of recordings and that kind of stuff for people who aren't able to attend, but certainly we can look into that. Assuming everyone's comfortable with it, so we can, if it's appropriate, we can also potentially put together a survey or something like that to make sure that people are comfortable with that format, but sure. Perlene has a question. What if a record, I assume that's a client record, was closed out by mistake? Would this be something we can ask for help with? Could you be more, again, please open a help desk ticket on that for what the specific issue is. But I don't know what you mean by a record being closed out. Does that mean the client was exited? Because I believe you can go in and delete the, exit as a user. Again, it depends on whether it's one of your projects or somebody else's project you may have visibility to, but unless I'm mistaken, I believe as a user you can remove the exit if you put it in there in error. So a coordinated entry exit, if that was entered by the coordinated entry folks in error, then your contact should be to the coordinated entry folks who did the data entry to that team. Again, as the HMIS lead, we don't want to get into, we don't want to be in the position of mediating what data is correct or not correct in the system from a data entry perspective. And if another agency or another group entered data that you have some issue with, then your issue is with that agency and that group, not with us. Other questions? If not, I can give you 7 minutes of your day back. Thank you again all for attending. Oh. So Felix is asking the question of, do we currently have the capability to merge providers' electronic records with HMIS? That's a pretty big topic. So Felix, if you'd like to have a conversation, there is not a user accessible upload function in HMIS, just as a short answer. So I don't know what kinds of electronic records we're talking about merging, whether there's even a place to put the data or things like that. So in general, the answer to that is no, but if you have specific questions, I think we can handle those offline. Again, thanks everyone. We'll make the slides available to everyone who is invited to the meeting, and enjoy the rest of your day. Thanks very much for attending.